flu virus, and also COVID-19, of course, is one of the causing factors of such symptoms of coughing and fevers, and also Streptococcus pneumonia, Haemophilus influenza. These are also at play, and also Mycoplasma pneumonia. These viruses, including RSV, can also cause infections on the respiratory tracts, leading to fever and coughness. For infections of RSV, there are symptoms of shortness of breath, and the Boca virus is often at play too. Thank you. Please, in the fourth row on the right. Phoenix TV. I'm interested in the elderly. For the people who are old, they stay at home. They are worried if they have symptoms. So when they have symptoms, under what conditions should they stay at home to use medication? Under what conditions should they go to the hospital? Li Yemin, thank you. Thank you for your question. As you have mentioned, the elderly and the children are the vulnerable groups in the winter season, suffering from potential risks of respiratory infection. For the elderly, they have some unique challenges. We need to keep them under close observation, understanding their basic vitalities, vital data, their blood pressure, and the frequency of breathing, inhaling and exhaling, their basic temperature, and if they have a cardiovascular and other underlying disease. We need to understand what their SAT is. If they are infected, we need to collect such basic data and monitor how they change. And for the elderly, we also need to keep an eye on their general conditions, whether they are of good mental energy, and whether they are still being aware of what's happening around them. If the conditions change, for example, if the fever continues or worsens, we must be on guard. If there are new symptoms, for example, if there are chest pains or difficulties in breathing and incontinences, and also if the limbs cannot move out of nowhere suddenly, for these new symptoms, or if the elderly cannot eat properly, they have nausea, or if they are overly sleepy. For example, they were previously very clearly minded, but now they are often very drowsy and sleepy. All these point to dangers. And also, we need to understand their underlying conditions. If they have chest pains, heart pains, if they have OPCD, which is worsened. For these chronic underlying diseases, if they worsen, that reminds us that maybe they need to go to the hospital for treatment. And also for underlying conditions, if such conditions are not stable, for example, they have severe respiratory disease or heart disease. For example, if we have a person who is 80 or older, if they have not been vaccinated with the COVID-19 vaccines, for such populations, they are the most vulnerable out of the vulnerable groups, so they need our special attention. Thank you. On the left, in the third row. Thank you, moderator. Southern Delhi. My question is, for families with children, what are the necessary medicines they need to have in store if there is an infection of COVID-19 for children in different age groups? What are the precautions of using medication? Qian Suyun, please answer this question. For families with kids, they should store some ordinary medicines for treating common children diseases, but we do not recommend hoarding. If you hoard too much drug, if you don't take care of them, they might lead to mismedication. So for the drugs that need to be in stock, anti-febrile drugs such as ibuprofen or acetaminophen, one of the two will suffice. For children under 6 months but older than 2 months, ibuprofen will not work for them, so they should go with acetaminophen. For kids under 2 months, we don't recommend the use of ordinary anti-febrile drugs. Physical measures for reducing the temperature is recommended. For fever, coughing, and infection of the respiratory tract, we can store some drugs for clearing the fever and the spit. So coughing is a defensive reaction. It can facilitate the discharge of a secretion. So if it's coughing, we don't suggest the use of antitussive drugs. You can use nebulization, or you can increase the humidity of the room to make it more comfortable for the kids. If the coughing is very bad, we can use some Chinese traditional medicine to reduce the fever based on the age of the kids.
But we do not advise two antitussive drugs in combination. Similar is true for antipyretics. We do not suggest the replacement or interplaced combination use of antipyretics. Please follow the prescriptions or doctor's advice. Children are also advised to pay special attention to the spacing of tool administration. There is no so-called personal experiences of parents in providing the drugs to children. Given the organs of the children are not fully fledged, we should follow physicians' advices and study the prescription carefully. Most of the hospitals have televised medical services. When you are not sure, you can always seek online services to get advice and suggestions from professionals. Thank you. Next question goes to the journalist from the right side, second row. Thank you. With CRN, patients suffering from cardiovascular diseases need to have better protection. If they are positive, will there be a bigger risk for them to developing into severe cases? I'd like to invite Mr. Zhou Yujie to take the question. Patients with underlying cardiovascular diseases, particularly those with hypertension, coronary diseases, or those with implanted surgery, or cardiovascular patients who have gone through major surgeries. Patients as such should pay special attention not to be infected with the coronavirus, have good sleep, good diet, avoid anxiety, and to reduce the fat intake in your diary, and pay special attention to the protein content, the diet mix, the percentage of sugar and fat. Patients as such should also pay special attention to their psychological health, avoid from unnecessary anxiety or fear. We have some suggestions for patients with cardiovascular diseases as recognized by the WHO. First, proper diet. We have a period of proper diet. Oil, salt, and sugar content are the least recommended. You must have a lower intake of the 3 types of food. Second, avoid from alcohol or smoking. Some rumors say that if you have alcohol beverage, which the alcohol content is about 65%, you can be free from COVID. It is pure rumor and disinfection. Alcohol beverage may even trigger COVID. Rather, smoke cessation and limit of alcohol beverage will help you to stay away from infection. Third, have proper exercises. Anaerobic exercises is recommended. For example, you can use 2 bottles of mineral water and use them as a small instrument to do some indoor exercises. And fifth, have a good psyche. Be healthy in your mental health. It's like we are sailing on the sea, and towards the end of the day, we will have our ships anchored. Pay special attention to your underlying diseases, have a good protection, so that your underlying diseases won't be the trigger of COVID. With China.cn, what if pregnant women are infected, or if there are infected or close contacts around the pregnant women? How can they be better protected? Madam Qiao Jie is taking the question. If a pregnant woman's family are infected, there is no need to worry. If it's possible and eligible, we'd rather have some spatial separation. Do not dine together. Separate your usually used items. Do not use the same toilet, or if you have to, have a good disinfection. Have a good ventilation of the room. If your co-worker is infected, the workplace better have remote working. If you have to continue to work in the same environment, pay special attention to the ventilation of the working environment, and co-workers are advised to have a rigorous mask mandate of N95. Prevention always tops treatment. For pregnant women, you are advised to minimize the visits to public crowded places, avoid gathering. When you come back from an outdoor environment, have good hand hygiene by using the soap or use the 75% alcohol hand sanitizer. Equally important, being it senior or pregnant women or children, proper diet and sufficient sleep are always important. Have an optimistic mindset. For pregnant women, they have to regularly go to hospitals to have perinatal treatment and diagnosis. So when you visit hospitals, you should have a proper mask mandate and have a proper arrangement and appointment to minimize the stay in hospital. We have equipped the hospitals with telemedicine and online diagnosis. If you don't have to physically visit the hospital, you can always seek online services. There are also a lot of online schools for pregnant women. Pregnant women and their families are advised to have more knowledge to have better self-monitoring and disease prevention. With the Dragon TV, we've noticed that some public think vaccination does not prevent infection, and some believe if you get infected, you can naturally develop antibody. Therefore, it's not necessary to get vaccinated. What's your take? Mr. Wang Huaqing is taking the question. Thank you for your question. Vaccination can prevent infection. Vaccination can prevent onset of the disease. Vaccination can also prevent severe cases or death. Maybe vaccination in terms of preventing infection may not be as ideal or perfect as one imagines, but vaccination has been proven effective in preventing severe critical cases of fatality. That is why the WHO countries and regions are all actively promoting vaccination. Enormous monitoring and research data have shown, compared with the vaccinated, the unvaccinated carry much greater risk of developing the disease, in particular among the seniors and people with underlying diseases. The risks are high among the unvaccinated. In particular, there is a higher risk of hospitalization, severe case of fatality. Full course vaccination and vaccination with booster doses can substantially reduce such risks. Therefore, we always suggest you minimize the risk of developing severe cases of fatality through vaccination. This is particularly effective in protecting the seniors and people with underlying diseases.
Thank you, moderator. My question is, if a child is infected with COVID-19, what are the manifestations? Are they similar to those of the adults? How can we effectively help the children to guard against the invasion of viruses? For children, after infection, their manifestations are similar to those of the adults. So most of infections are with upper respiratory tract. Most of the symptoms are fever, coughing, and runny nose, and discomfort of the throat. For some of the children, they even have convulsion and shortness of breath. For children with a fever, the extent of the fever varies from one person to another. For some of the children, they have 39 degrees or 40 degrees. However, the stage of fever is just 2 or 3 days. So the fever will retrench after 2 or 3 days. So the stage of the disease lasts for about 3 to 5 years. These are the manifestations of children, so it's unlikely they will get a severe case. Please continue. On the second row, on the right. Thank you. Health Daily. I'm interested in the elderly. For people who are very advanced in their age, and for people who are disabled, they are not able to express themselves clearly. So when they have discomfort, they cannot use words to express themselves. So how can their family members and also the caretakers of nurseries, nursing homes identify their symptoms and take timely interventions? Thank you. Thank you for your question. For the elderly and for their caretakers, we first need to understand the common symptoms of COVID-19 infection. It's a respiratory infection disease, so there are whole body symptoms like fever, soreness throughout the body, and also there are localized symptoms, for example, pains in the throat, coughing, and also these are the localized symptoms. So we need to understand their symptoms. For the elderly. They don't sometimes show symptoms that are typical, but for some of the elderly, their symptoms are typical, and their disease progression is quite secret, and they don't have good mental energy, and their diet, they lose their appetite, and for example, previously they walk fine, but now they walk quite staggeringly. So this suggests infection. And we also need to understand their underlying conditions, their underlying temperature, because for the elderly, they are not in the position to express themselves. They sometimes cannot tell you that they have fever, so we need to monitor their body temperature to identify early rises in body temperature and also rhythm of the heart, fastened or the in greater intensity of breathing. All these are suggesting proper infection, possible infection. So we need to take care of them. Thank you. On the right, in the fourth row. CG10. Compared with the young adults, for the elderly, when they are vaccinated, their adverse reaction is higher or lower? Wang Huaqing. Thank you for your question. First of all, I would like to tell you what adverse reaction is. For adverse reaction for a vaccine, it's a result of the inherent features of a vaccine, and also it's a result of the individual differences of those who are vaccinated. So after some people are vaccinated, they have some reactions. These reactions have nothing to do with the purpose of vaccination. These are unexpected. Adverse reactions include general reactions and abnormal reactions. And most of the reactions are general reactions. A small number of people will have abnormal reactions. We have been monitoring the reactions after inoculation based on the data we've collected for people who are 60 or older after being vaccinated with COVID-19 vaccine. For them to have adverse reactions, especially severe adverse reactions, the rate or likelihood actually is lower than those who are under 60. So most of the reactions are ordinary general reactions. Only very few have abnormal reactions. Severe abnormal reactions is 1 out of a million or lower. Thank you. From Hong Kong, Zhongpin She. For the elderly, some of them live alone. There's nobody living with them, so their rate of vaccination is very low. So for such people, should they be vaccinated? Sometimes they think that they don't have any social contact, and there are nobody else in the room, so they don't need to get vaccinated. Is that right? Living alone does not mean being totally isolated from society. In the early stage of COVID-19, for most of the people, because the spread of the disease was quite limited and it was not highly infectious. So now it's a different story. It's spreading much faster and it's more infectious. And also in some regions, we see ongoing transmission of COVID-19. So under such a context, for anyone, including those elderly people who live alone, they face a high risk of being infected. If they don't get vaccinated, they are going to have a higher likelihood of incurring severe cases or even mortality. Why is it more mortal for the elderly? Why there are many more severe cases for the elderly? Because as people age, their immune function weakens, and also most of the elderly have underlying diseases. So after being infected with COVID-19, their underlying conditions will have a risk of being worsened. So in such a context, we still recommend, even you are an elderly who live alone, or if you are an elderly person living with your family members, as long as you don't have full vaccination, we suggest you get a vaccination and a full vaccination, including the booster shot. This will provide stronger protection for the elderly, and those will make your family members more at ease. Thank you. In the third row on the left. Thank you. Shenzhen TV. My question is about pregnant women, women in childbirth, if they have fever or coughing, what should they do? Qiao Jie, please answer the question. If a woman in pregnancy or childbirth have fever or coughing, they can do nucleic acid test or antigen test to see if it's a COVID-19 infection. And if they stay at home, antigen test is more convenient. Whether or not it's a COVID-19 infection, they should take the following measures: drink more water, using physical means to drop the temperature, and if they are using antiviral drugs, for example, they can use acetaminophen for the purpose of suppressing the fever. So choose a proper antiviral drugs. And also you can try Chinese traditional medicine. Anyway, you need to stay with one medicine. Don't use multiple medicines together. That will create a risk of damages to your liver and kidney. And also for women in childbirth and pregnancy, they need to do 3 monitorings. First, monitoring of the temperature. Second, of the heart rhythm. And third, of the blood pressure. So they need to have a barometer for the devices for monitoring and measuring their heart rhythm, their blood pressure, and their temperature. So any abnormalities can be identified very early. And also for women in childbirth and pregnancy, they need to pay attention to the fetal movement. For example, 1 hour of monitoring every day. Within that hour, 3 fetal movements if the fever lasts 3 to 4 days and there is no relief in after the drugs are applied, and the fetal movement disappears, and if there are symptoms of head pains, dizziness, and heart palpitation, short of breath, they need to go to the hospitals, and they need to contact the midwifery institutions.
The journalist from the second row on the left. Thank you, Mr. Moderator. With daily economic news, winter is the season of frequent onset of cardiovascular diseases. What are experts' suggestions for preventing the onset of cardiovascular diseases? Mr. Zhou Yujie is taking the question. Cardiovascular disease onset is quite often, as the public often say that during the 3 coldest 10 days in the winter, we most frequently see the onset of cardiovascular diseases and cerebral diseases. Hypertension, cardiovascular, cerebral vascular, COPD, and many deadly diseases will see a higher incidence of onset during the coldest days of the year, because there will be contraction of the vessels during the cold weather. That's why we advocate keep yourself warm, in particular among the patients with the underlying diseases or genetic inheritary reason. Because the diameter of vessels and its contraction, expansion have a lot to do with how warm you keep yourself. Second, have a proper diet. Avoid the intake of oily, salty, or diet with a high cholesterol. Have a proper time of exercises. Avoid going to the gyms at a very early time of the day when the weather is cold and when you are not well fed. So choose a proper intensity of exercises. And next, avoid smoking and alcohol beverage, because smoking will make your vessels even contract, and the alcohol will damage the insulin of your skin. Besides, we advocate a healthy mindset. Anxiety, overexcitement, fatigue, binge eating, and coldness are major triggers of cardiovascular diseases. So if you are a home quarantined coronavirus positive patient, you should have proper health monitoring of your heartbeat, your hypertension, your blood pressure, have a proper way to manage these major aspects and reduce the incidence of cardiovascular diseases. Thank you. Next question goes to the journalist on the fourth row of the right side. Thank you, Mr. Moderator. With the 21st century economic news, if children are having a fever or developing coughs, should they be sent immediately to hospitals? When is it necessary to send to hospitals, and when is it enough to take care of them at home? Madam Qian Suyun is taking the question. I'd like to make some additional remarks to the question put forward by the previous journalist as to what are the measures effective in helping the patients against the COVID-19. Very importantly, eligible children should get a full course of vaccination. Children below 3 years old, there is no recommendation of vaccination. So for young children below 3 years old, the livers in the same family household should be active in getting vaccinated, providing safeguards to children. We've noticed that most of the coronavirus positive children are infected by their family members. Parents should also have proper protection of themselves. As previous speakers have mentioned, when parents come back home from outside, have a good hand hygiene, change your clothes before you come in contact with your children, have a good ventilation at home, and if there is any positive patient, you are advised to live separately with the children. Cultivate a good, healthy habit for children, including the mask mandate. During winter time, we do not suggest going to publicly crowded places or any semi-confined areas. Have a proper diet. Have a good intake of water, vegetables, and fruits. Have a good sleep and a very healthy lifestyle. Improve communication and interaction with your children. Feel happy. Next, very important thing that parents pay special attention to is when should you take your children to hospitals. The simplest way of judgment is looking at whether your child is still bouncy and energetic. Even if they have developed a fever, when the fever is brought down, they eat, drink, and play as usual. For children as such, they don't have to be taken to hospital. Follow up with care at home. But if the children develop the following symptoms, we strongly advise you take your child to hospital. For example, if the fever lasts for 3 days and the child is no longer energetic, even after the fever has been brought down. For example, children, especially young infants, keep crying or continue to sleep for several days. For a much long time, even their fever has been brought down, such symptoms still necessitate the visit to a hospital. And if there is frequent vomiting, frequent coughing that have compromised the daily life and sleep, children should be taken to hospital. If some young infants have developed respiratory depression, we should also take children to hospital. Of course, if there is awareness, failure, or convulsion, children as such should be immediately taken to hospitals. Infants below 3 months old are considered as very special. So once they develop fever, they should be immediately sent to hospitals. We see there are a lot of questions, but as we are running short of time, we will take two last questions. A journalist from the third row on the right side, please. With the CNS, some seniors say they wanted to get vaccinated, but because of their underlying diseases, they were assessed as not eligible to take a vaccination. Doesn't mean that they don't get the chance to be vaccinated. Mr. Wang Huaqing is taking the question. Thank you for your question. There is a contraindication for sure, that is severe allergy after vaccination. This is the absolute contraindication. All other contraindications and all other those forbidden are only suspended in their vaccination. For example, the cases you've mentioned, if a patient have underlying diseases and have been assessed as not eligible to be vaccinated, it is usually because it is during the acute onset of the underlying chronic diseases. After treatment, the situation may be stabilized, or maybe the patient has been undergoing some special treatment, so they were assessed as not eligible to be vaccinated. But if their treatment is over, their disease is no longer in the acute onset, they need to undergo another round of assessment, and if they are eligible, they are advised to get vaccinated.
So for the elderly, before they are vaccinated, as mentioned by the experts, we need to help them take proper precautions. These are necessary. If their disease underlying conditions stabilize, if there are special medical conditions, and now they are eligible for vaccination, then we should vaccinate them as soon as possible. The last question on the left in the fourth row. Thank you, moderator. The New Delhi. My question is also about the elderly. For symptomatic patients and for people with mild symptomatic symptoms, for the elderly, their situation is more complex. Sometimes they use mismedication. What should we do to prevent mismedication or abuse of medication? For the elderly, if they are infected by COVID-19, the first point is that we need to do a closer monitoring and observation. And secondly, we need to do a better job at day-to-day caretaking, including light diet, because for the elderly, if they are infected, they lose their appetite. So we suggest small meals and increase the frequency of eating. And also they need to drink more water, and they need to sleep well. And also based on their temperature and their sweating, we need to add water to their body. Don't drink too much water at one gulp. Because if you drink too much water at one go, you will feel discomfort and your heart will be under a lot of pressure. And also for antifebrile drugs being used with the elderly, we need to be cautious. For the elderly, if they have a higher temperature, if their age is older, we need to take special precautions. This is for preventing too much or excessive sweating for the elderly, and this might lead to prostration. And also, after they use multiple medications, we must do everything possible to avoid giving them multiple drugs. For example, if you use acetaminophen. If we are using other drugs at the same time with acetaminophen, that might create a lot of problems, and you must be careful about it. And also, you can also try Chinese traditional medicine. For the Chinese traditional medicine, it's the same story. You should avoid using multiple drugs at the same time. And also, the management of the underlying disease after being infected, the elderly must take proper precaution of their underlying conditions. Two cautions. First, for hypertension drugs, because of fever, because of the water loss of the body, the blood pressure will drop significantly, so we must monitor it. And if the blood pressure goes to a very low level, we must consider stopping applying the medications. And also for blood sugar drugs, reducing blood sugar drugs, after being infected, we need to monitor their blood pressure to prevent the blood pressure from going too low. And also, I would like to remind the elderly, once they are infected, they are less stable with their body, with their limbs. The same is true for the young people. For the elderly, when this happens, it's likely they will fall, and this will lead to bone fractures. So if they have fever, if they are weak, we must take precaution to prevent falling. They must be accompanied by their family members. If someone lives alone, there should not be too much stuff on the floor of the room. Otherwise, if someone falls, he or she might be hurt severely. And also, the floor needs to be kept dry to avoid sleeping. And also, the clothes should be proper in terms of its size. Otherwise, improper sized clothes will cause falling too. And also, if they go to the toilet during the night, they need to make sure that they are clear-minded. They should sit up and stay in bed for a few minutes. Then they go to the toilet, and there should be handrails in the room so that the elderly can support themselves as they move around to go to the toilet room. Thank you. For today's press conference, we have experts who touched upon a wide range of issues on the health of the elderly, the children, and the pregnant women, and also there are questions about the vaccination of the elderly, and the questions are very targeted, and the experts' answers are very clear, very responsive, and they give us a lot of good suggestions and health tips based on their clinical experiences, which are really us to maintain our health of our family members. I would like to thank you for your participation. We are going to hold a series of press conferences in the future, so you are welcome to attend again. That's the end of today's press conference. Thank you.